Welcome to Next Generation Healthcare, proudly presented by Optimal Telehealth. Are soaring health insurance costs for your family or business causing you stress? Tired of the long waits and high fees for a simple doctor's consultation? Then you found your podcast. Next Generation Healthcare is here to empower you to take back control over your healthcare decisions, freeing you from the constraints set by insurance companies. In our episodes, you'll uncover the secrets to circumventing traditional insurance to access direct services from your preferred providers at savings of 40 to 50%. This podcast is a creation of Larry Stout, the visionary founder and CEO of Optimal Telehealth. Now, let's hear from Larry.
Thanks, Mandy, for that introduction, and thanks for our viewers for tuning in. We're again broadcasting from our North Texas studio today. Texas is my happy place. I always enjoy being here. In the last couple of episodes, we compared medical cost sharing to traditional insurance, and then looked at the history and evolution of virtual healthcare over the past 150 years. In a future episode, we're going to take a closer look at Sedera, our medical cost-sharing provider, but I'm inviting a special guest from Sedera to contribute to that show. Today, we're discussing an extremely important topic and one of the primary considerations for anyone converting to medical cost-sharing. The underlying concept that drives next-generation healthcare is the idea of becoming a cash-pay patient. Once consumers understand the insurance industry inflates the cost of medical services by 80 to 100%, the only logical way to significantly reduce the cost of medical services is to bypass the insurance industry. This can be a scary proposition, so a normal initial response would be, can I afford that? I'm not rich. The good news is you don't need to be wealthy to become a cash pay patient. Almost anyone can do it. You won't believe the abundance of resources available to you in this transition. The U.S. government supports the concept. Medical service providers support the concept. Cost-sharing communities support the concept, and our American free market system supports the concept. You can't hold back a good thing forever, and the time for cash pay medicine is upon us. Let's take a closer look at why cash pay has become a national movement. It begins with understanding who pays for health insurance. The American free market system has always stepped up and provided solutions when something's not working, and our healthcare system is not working. Healthcare has become so expensive the average consumer can't afford it. The leading cause of bankruptcy in the United States is medical debt. 50% of Americans rely on their employer to provide them with health insurance, and the employer generally pays for all or part of the cost of that coverage. But what does the employer do with the expense they incur for providing that employee insurance coverage? They pass it on to their customers. So the ultimate cost of employee health care is absorbed by the American consumer in the form of higher prices for goods and services. We are all paying that bill. Slightly less than 10% of Americans purchase their own health insurance, much of which is purchased through the exchanges created by the Affordable Care Act. The government subsidizes those exchange policies by paying a portion of the cost of the insurance company to the insurance companies using tax dollars. Those tax dollars come from the average consumer. So in reality, the average consumer is paying a portion of the cost of all health insurance policies purchased through the health insurance exchange. And don't forget about Medicare, Medicaid, and military health care, which are also paid for by the government and redistributed to citizens in the form of taxes. This segment makes up over 20% of the population. 8% of the remaining population has no insurance coverage at all, so where do they go when they get sick or they're injured? They go to medical service providers who are required by law to treat them at no cost. And no matter how you look at it, the consumer eventually pays that bill. I hope you're beginning to see that our broken healthcare system passes billions of dollars in healthcare services to consumers every year, and that, my friends, is a preventable tragedy. Let's review the support available to migrate to cash pay. In the early days of the cash pay movement, patients had to be diligent shoppers and look for sources that provided reduced rate cash pay service prices. As medical service providers began to recognize the benefits, they made cash pay discounts more readily available. Every patient who paid in cash helped to reduce the administrative overhead associated with that provider's insurance relationship. Primary care medical practices not only embraced reduced cash pay rates, but they also began converting their practices to a direct primary care business model. With direct primary care, patients have the option to pay the practice a fixed monthly membership fee in return for drop-in or short lead time appointments, with all services provided through the practice, including the cost of membership. In other words, members could see their doctor on short notice with no added cost for services. As time moved on and new technology became available, some of these same family medical practices invested in the communications technology necessary for them to deliver telehealth services directly to their patients. This new virtual direct primary care was the forerunner of what is now called virtual primary care in the telehealth industry, whereby telehealth memberships can now connect patients with the same doctor every time they call, drastically expanding the diagnosis and treatment capability of the doctor. It goes without saying that medical cost-sharing communities have been pursuing cash pay service providers for almost 30 years. The greater the demand for cash pay services, the less resistant there was to providers. Ultimately, it simply became a common part of the provider's business model. The government made it official in January of 21 when the Department of Health and Human Services began enforcement of hospital and insurer price transparency rules that require all insurance companies and medical service providers to publish both insurance and cash pay services. Just like GoodRx became a prominent brand for providing a common place to locate the best price for prescription drugs, companies like MDSave and Savos Marketplace are becoming go-to sources for reduced-rate cash pay medical services. We'll talk more about this and companies like this in future episodes. Access to data is a valuable resource, and this is the final cash pay support component I'll touch on. The commercialization of healthcare services created a demand for data that would help patients become informed consumers for healthcare services. Companies began emerging that accumulated all the data necessary to make healthcare price decisions, such as what are the Medicare and Medicaid prices for the treatment of any given illness or injury by geographic location? What is the insurance negotiated rate for treatment of any given illness or injury by geographic location? What is the fair cash price rate for the treatment of any given injury or illness by geographic location? Data such as this can be a huge resource for insurers as well as large corporations that are self-insured. Health share communities and patient advocates also find this data essential to their operations. In our first episode of Next Generation Healthcare, I shared that I began my professional life working in the automobile industry. I'm old enough to remember when it was a closed industry. You may not realize there was a time when there was no price stickers on the window of a car. The customer simply asked the salesman the price of the car, and the salesman could tell them anything they wanted to. In 1958, when I was 10 years old, Senator Monroney from Oklahoma sponsored a bill that required car manufacturers to post a price sticker on every car so consumers could have a standardized starting point from which they could begin negotiating their purchase price. The sticker was appropriately called the Monroney label. Ultimately, with the availability of information facilitated by the Internet, new cars officially became a commodity because anyone could learn the dealer's cost on any car in the market or the fair market value of a used car. The period of deceptive sales practices was over, and the dealers had to begin relying on quality customer service to keep customers coming back. A direct correlation can be drawn between the evolution of that auto industry process and the concept of migrating from insurance-based health care to cash pay health care. Just look at the common points. Big Auto was restricting access to data, but ultimately, when consumers pushed back, government got involved, so they had to accept the change and alter how they did business. Today, big insurance is in the final days of controlling all the information consumers need to become smart shoppers of health care. That information is now readily available, so the only thing remaining is for the consumer to become aware of its presence and begin taking advantage of it to become smart shoppers of medical services. What are the advantages of cash pay? Well, the obvious advantage of becoming a cash pay patient is the money saved when obtaining medical services. But I hope you're beginning to see the benefits far beyond that initial savings. I can't help but think of the old saying, a rising tide floats all boats. Billions of dollars in medical expenses currently being distributed to taxpayers by the government. With affordable health care that is easy to access, the need for such redistribution diminishes, and the threat of being forced into government-controlled single-payer health care becomes unnecessary. What about the health insurance industry? How do they respond to the loss of revenue? It's simple. They respond the same way any business does when faced with significant competition. They get more competitive. They find ways to reduce overhead and lean up their operations to increase efficiency and productivity. There will always be a place for health insurance in the market. It will never be totally replaced by cash pay health care. But the free ride needs to end, and big insurance needs to trim the fat out of their industry. What about the impact on medical practitioners? Would it be great if they could spend more time with each patient and become more proactive in managing good health instead of just treating the current ailment? Increased utilization of virtual primary care medical services would undoubtedly decrease the incidence of major medical events in our population, as has been demonstrated in other developed nations. So you see, becoming a cash pay patient really isn't so scary. Most of your primary care medical services will be obtained virtually for a low monthly fee. If referred to specialists for in-person services, those services will be obtained at a reduced cash price. If major medical services are prescribed, your health share community is there to provide the financial protection you need. When everything is said and done, the out-of-pocket expenses are considerably less compared to insurance deductibles and copays. As you know, I'm always receptive to any questions you may have on this or other related topics. If you're interested in learning more about this, check out our resource center at optimaltelehealth.com. You can locate the link in our show notes. You'll find an unlimited number of podcasts, blogs, downloadable guides, and more to ensure your healthcare solutions and savings are empowered by you. We hope you found this episode informative. Until next time, remember, next generation healthcare fosters a brighter and more powerful future for all.
Thank you for tuning in to Next Generation Healthcare, brought to you by Optimal Telehealth. Your engagement means the world to us. If you find our content informative, follow our podcasts on Apple, Spotify, or YouTube. We welcome your participation and will review listener input in future episodes. To leave your questions or comments, access additional episodes, or browse our blog post library, please visit the resources page at optimaltelehealth.com. You may also connect with us on LinkedIn, Facebook, or Instagram for the latest insights and updates. We look forward to welcoming you back soon. Your journey towards empowered healthcare continues with us.